Yeah, we're going to get started. So, thank you for joining us. We really appreciate you being here. My name's Josh. I am the marketing and membership vista here at Mental Health America of Greenville County. Um, we are hosting what we call our My Mental Health Month story series this month. So, we're having guests from the Greenville community, and they're going to share just their journeys with mental health, their work with mental health, whatever it is it may be. Last week, if you were with us, we had Kylie Odetta. She was a singer-songwriter from the Greenville area, and she just talked about her music, and that was a really wonderful thing. And we'll have that up on our social media later if you missed out and you wanted to view it. But today, we are joined by Dr. Frank Clark. Dr. Clark is the medical director of adult inpatient services at Marshall Pickens Hospital at PRISMA Health. He's also a board member here with us at Mental Health America of Greenville County and a board member of NAMI Greenville. So he is a very busy man, and we are very thankful to have him here to talk with us today. He's really passionate about mental health, obviously, given his work as a psychiatrist, and he's going to talk today with us just about his journey. And before he gets started, if you have any questions for Dr. Clark while he's talking, just send me, the moderator at Mental Health America of Greenville County, a private message with your question for Dr. Clark, and then we'll have a little bit of a Q&A session at the very end. And so without further ado, I'm going to turn it over to Dr. Clark.
Thank you, Josh, and thank you, Susan, for inviting me to participate in this this mental health series for today, and I'm honored to be here and to be with all of you on virtually. So I feel like I'm doing most of my meetings by Zoom these days, so I'm good to be with you all. So as Josh, can everybody hear me? It's good, okay. So as Josh said, I am a psychiatrist practicing Greenville, South Carolina at PRISMA Health, and my wife and I have been here now going on 3 years, and so it's been great to be back in the Palmetto State. I actually, we moved here from Southwest Virginia in Radford, Virginia, where we were practicing. My wife is also in mental health. She's the other Dr. Clark, the smarter one, I'll say. She's a psychiatric nurse practitioner, and so we both work for PRISMA Health, and she mainly does outpatient work and has an interest in women's mental health, and then I mainly practice on an inpatient setting and work with individuals. I see a diverse group of individuals, ranging from individuals who are suffering from depression, anxiety, substance use disorders, personality disorders, schizophrenia, and bipolar disorder. So I love what I do. I've been practicing now, it'll be, I graduated from medical school in 2010, so been practicing for about 10 years now, and I enjoy psychiatry. I actually was going to become a pediatrician when I entered medical school, but psychiatry really spoke to me in terms of its connection between the mind, body, and soul, and that's something that I think is important when we talk about mental health in general. So I wanted to spend this time with you all to just share my journey with you and why I think that mental health is important to our communities, and also when it comes to that whole mind, body, spirit connection, and how we shouldn't be ashamed of if we have a mental illness. It's no different from having diabetes or cancer or high blood pressure. Health is important, especially if we talk about longevity and life expectancy. So my journey actually started back in 2002, 2003. So I'll give you a little bit of background about myself. I grew up on the south side of Chicago, born and raised. I have not developed a Southern accent, even though I married a Southern belle from Tennessee, but I enjoy the Midwest and did most of my schooling there, with the exception of residency in Columbia, South Carolina. But graduated from Monmouth College, and while I was there, I was a student athlete. Participated on the track team and cross country team. So that allowed me to keep a balanced life, so to speak. And in retrospect, it was good for my mental health. But I was my journey was that things were going smoothly for the most part. I did well in college and got accepted to medical school and graduated from Northwestern University Feinberg School of Medicine in Chicago. And that was my dream school. And I actually received a full ride scholarship to medical school. And so, which is rare. Most of us come out of medical school in severe debt, on average about 200,000. So to get a full ride scholarship, that was a dream come true in many ways. And then things I kind of went down, I had a downward spiral for me. So after I graduated from college, I was able to graduate, and I was blessed to graduate in 3.5 years. At that time, I was in a relationship, and that relationship went south. And following that, I went into a deep state of depression. And in retrospect, I would have called it depression at that time. I really didn't know what depression looked like. Again, overall, I would say that my journey up until 2003, things were overall pretty good. We all go through adversity and we have our ups and downs, but never in my life had I actually experienced what it meant to actually be depressed. And so I had the classic symptoms. I wasn't eating, I wasn't sleeping, I stopped taking care of myself, I wasn't running anymore, and I felt very isolated. At times, it was very distressing to just kind of wake up into a dark place, I would call it. That's how I would describe depression for me. It was kind of this dark hole, dark place for me that was very debilitating to my overall health. And so I would say that I think we all know that there's a stigma when it comes to mental illness. And I'll be honest with you, before being diagnosed with clinical depression, I probably had a stigma as well of, or maybe the pride issue of that won't happen to me. And so I think it was a very humbling experience to say the least, to experience what it is like to kind of be down and out and feel like that life is not worth living. So I sought help, and when I got to medical school is tough, as you can imagine, like any other profession. But we go through some rigorous curriculum, and it's quite the arduous journey, to say the least. So when I got to medical school, I went through a lot of adversity. I failed my first year of medical school. So I'll share my age. I'm 39. This actually turned 39 back in April. But I started medical school in 2003. And my medical school journey was prolonged, and that was due to academic difficulty, but also in combination with the academic difficulty, I was still, the depression had not lifted. And so I failed my first year of medical school, and then I failed step one of my boards. You have to pass two step exams before you can graduate from medical school. So now, instead of graduating in 2007, which would have been 4 years, usually most people graduate from medical school in 4 years, it took me 7 years. And so you can imagine that that was a blow to my ego in a lot of ways, because I had worked so hard to get to this point. I had a full ride scholarship. I ended up losing that scholarship. But in retrospect, that experience has made me a better person. I would say a better husband, a better father to our almost 17-month-old daughter, Claire, as well as a better physician. And so I think it is what I've learned over the years in terms of my mental health journey is that even though adversity happens, it's not what happens to you, it's how you weather those storms. Now, I wouldn't be able to tell you that back in 2003. Again, I was in a very deep, dark place, especially when I was seeing my classmates move on to another year. You can only imagine that would be quite debilitating, especially when you're in medical school and everybody is the cream of the crop. And so when you are failing exams and you feel like you kind of go through your own imposter syndrome of, am I meant to be here? Did I really deserve to get into what I consider a very prestigious medical school? And do I want to continue this journey? And I'll be honest with you, there were times where I had my doubts. I remember my mother telling me that He said, you know, this is your dream and you don't give up. My mother's a retired Chicago public school teacher, and I'm indebted to her and for a number of reasons. She's always been what I call my faithful fan, and has been a cheerleader for me throughout my journey. And so I was actually told before I even applied to medical school that I wasn't cut out for medical school. And so again, going back to that imposter syndrome, you know, being told that you'll never make it to medical school, and then actually achieving that goal of getting into medical school and then going through some adversity, you can one could imagine that would definitely kind of be a thorn in my side a little bit and be a stinger in the sense of how depressing that was for me. So I have sought my own mental health for over greater than 10 years now. I still do my own therapy. I'm a huge proponent of therapy. I see a therapist at least twice a week, virtually, which is awesome. And you know, I have no shame in saying that I have experienced depression, because again, it's no different than having diabetes or high blood pressure. I no longer take medications. Again, I was clinically depressed, and for the duration of my medical school career, I took an antidepressant. And I also know that I'm at risk of having another depressive episode. You know, it happens, but I've been in remission now for 10 years. And but I still do the things that I think are important to keep well. And that's one thing that if there's one take-home point I can leave with you today, as we are fellowshipping together virtually, is to remember to take care of yourself. You know, mental illness doesn't discriminate. It doesn't care if you're Black or white or Asian or Hispanic. It doesn't care if you're affluent, poor, middle class. It doesn't care if what your political affiliation is or what your religious affiliation is. I'm a man of faith. I will self-disclose that, because I think oftentimes there's a stigma. You know, if you believe, I'm Christian, but this applies to various faiths. You know, but I'll use my faith as a Christian. It says, well, if you just believe in Jesus and pray, you don't have to worry about being depressed. I love when I hear on the radio, I'm too blessed to be stressed. Well, what does that mean? You know, I'm a faithful servant of the Lord. You know, I pray, I read my Bible. I think I'm an overall decent human being. But again, I'm also someone who has experienced depression. And I think we have to be mindful of stigma. I'm a firm believer that stigma kills people, because people don't want to reach out. We would never tell our loved one if they had cancer, oh, I'm so sorry, you know, I'll be praying, you know, this is your fault. We would never tell someone that with cancer. But yet when it comes to depression or bipolar disorder, or a person is hearing voices and their reality testing is impaired, we say, well, you just haven't prayed enough. Or even with substance use, we tend to stigmatize individuals with substance use disorders. We say, well, you can lay off the bottle. You don't have to, you know, smoke marijuana. It's a choice. And what we know is that addiction is an illness. There is a plethora of research to support that. And so I'm a firm believer of advocating for the population that I serve on a daily basis, and that you know, and I'm one that has gone through it. I wouldn't want anyone to tell me that, well, Frank, you just need to pull yourself out of it. And again, I've been in remission for 10 years, but you know, we are in the middle of a pandemic right now, for example, with being COVID-19. And so you can imagine those individuals with mental illness, there's the potential that this pandemic will have worsening effects on a person's overall mental health. And even if you don't have a mental illness, it is still important to take care of our health. Some of the things that are important to me, or help keep me well, so to speak, or as my wife's pastor would say, what fills my love bank. And so I'm very mindful of that. And so some of those things for me include meditation. There's a wonderful app out there called Headspace, and it allows, it has various exercises that you can do for mindfulness meditation. It even has meditations for going to bed at night, that soothing music that we like to hear if you go to the spa. I'm a big fan of the spa, by the way. But you know, there's so many things that we can do to take care of our health. We don't have to be alone, and especially during this pandemic, I think I want to embolden all of you, and I want you to encourage your loved ones to make sure that they're taking care of yourself. Um, the other things that I have found to be important in my mental health journey in terms of wellness include exercise. So I alluded to earlier that I ran track and cross country in college. I actually started my running career in high school, and I still run for fun. I always say that I'm retired. I've done a couple of marathons throughout my life, one being the Boston Marathon, which I was blessed to qualify for. And I ran during the 2013 marathon, which was the year of the bombings. And so that has a special place in my heart. But I also enjoy dance. So there's the creative side of me. I think most people in medicine have a creative side. I think we're all creative and unique in our own way. We just have to tune into that creativity and don't let it go by the wayside, because we all have different spiritual gifts. And I'm a firm believer of that. So besides dancing and running, I also like to write poetry. And I will share one of my most recent pieces that I wrote. But if you like poetry, I self-published a book back in 2014 called The Other Side. And I almost didn't publish this book. I was inspired to start writing in medical school, ironically, and I needed to find a way of coping with my depression. And so what I decided to do was explore more of me. And so that's why the book is called The Other Side. And so it gives you a glimpse into I'll say who I was, because I'm a different person. The Frank of 2020 is different from the Frank of 2014, because I was in a different season of my life and going through a lot of different things. But I would write at my favorite tea shop in Chicago. It's called Argo Tea. And I would sit there and reflect about the many Goliaths, I'll call them, or storms that I was experiencing in medical school and even outside of medical school. And so I decided to write, and before I knew it, I had 40 poems that I had decided to write over time. And I was somewhat bashful about publishing it, because I've said, well, who's going to want to read this? You know, I'm no Langston Hughes, I'm no Walt Whitman. You know, what do I have to contribute to the world in terms of this poetry? Maybe I'll just keep it for myself. But I was encouraged by a friend to publish it, and she said, what do you have to lose, so to speak? And so I took her up on that offer, and self-published it. And I have shared it with family and friends, and I've encouraged them to share it with others. And from that, now I'm working on my second book, which will be called, the title I have right now is called Voyage of Creativity. And that will feature more pieces that I'm working on. Right now I have 10, and I'm hoping to get at least another 30 more. So I'm in a good creative space right now for writing, given everything that's been going on with the pandemic and other things. I wanted to take this time to share one of those poems with you that I have written, and it is called Runner's Paradox. And this is a tribute, somewhat of a tribute, I guess, and it was inspired by the horrific events that took place regarding Ahmaud Arbery, who is I think most of you have heard about his story, the young African-American man that was jogging in a neighborhood and was gunned down by two gentlemen who I'm going to say racially profiled him and had a lot of biases. And given those biases, he is no longer with us. But when I first heard about this story, the first thing I immediately thought was, that could be me. And so given that I run our neighborhood at least once or twice a week, I like to run in other neighborhoods. Running helps me explore myself, and it is a time for reflection. So after I heard about this story, I decided to write this piece, and I would like to share this with you at this time. And again, it's called Runner's Paradox. Strike with a gentle force to release the entangled web of ruminations. Stimulate atrophied muscles with rhythmic steps of gratitude. Shine in an ageless concrete that invites heavenly exploration. Run, run, run. Smell the refreshing aroma of soft winds gliding the human deer. Smile at faithful stars that guide creativity and store personal best. Speak to repleted lungs that require tranquility for the journey. Run, run, run. Fangs, dripping of bigotry, hasten to attack human black deer. Eyes from afar filled with gangrenous material halt the once swift glider. Hearts of infirmity congregate to infect the black dove. Bang, bang, bang. Thank you for allowing me to share that with you. It's actually the first time I've actually recited that to an audience, and for me, it represents, the first two stanzas represent what I think it means to be a runner, and how freeing it is to be to run, to exercise, to just let it all out, and to really explore who I am as a person. I think most runners, we talk about that runner's high that we feel. But I never thought in my life that I would have to write that last stanza. And so we talk about mental health. My mental health, I would say, was somewhat compromised when I heard about Ahmaud Arbery's story. And so I had to immediately go to what I'll call my happy place. And that happy place for me is writing. And I encourage you all to find what fills you up. Again, what fills your love bank? That may be writing, that may be crocheting, you may have a green thumb. I applaud anybody who has a green thumb. I have killed 2 of my wife's orchids that she has given to me for a gift. And so I've decided that is not something that I will continue. But writing for me is my happy place. And it allows me to be in a headspace where I can just be. I can be myself. I can put words on paper. Because I'll be honest with you, stories like this make me angry. And again, it can be very debilitating. I think we can all think about stories I think we've heard in the news, whether it be Ahmaud Arbery or other things that are going on in people's lives that evoke mixed emotions. But I also have learned over the years that it's okay to be angry, but not to stay angry. And so that's why I'm thankful and blessed that I have this talent of writing that allows me to express myself on paper and to do the things that are going to help me stay well. Staying well can help improve our overall sense of being. Staying well allows us to, I think, live our best life. There's a book called The Purpose-Driven Life, and I remember reading that years ago, but I believe that we all were put on this earth for a purpose. And some of us may still be searching for that purpose, but I'm thankful that each and every day that I have a purpose as a husband, as a father, and as a physician. And to be here with you all today talking about my mental health journey is refreshing in a lot of ways. It is, I enjoy the fellowship because it allows us to be transparent with one another. And I think it helps, one of the things that I share with people, I do a lot of mentoring, and one of the things that I share with my mentees, I tell them my story about medical school, especially if they're wanting to go into the medical profession or any profession that they decide to pursue, is that if I made it, so can you. A lot of people, sometimes I think they look at, and I'll use physicians for example, of, you don't know what it's like to struggle. You make a lot of money, you live in a nice house, and you drive a nice car. And I think when we make assumptions of people based on what we see on the outward, outward appearance, we usually are wrong. And so I hope me sharing my story today as a person who has gone through adversity, as a person who has experienced firsthand what it means to have a mental illness in terms of depression, I hope that this will inspire you all to take your health seriously, to also realize that you're not alone. And if you are suffering, you don't have to suffer in silence. None of us have to suffer in silence. It kind of just rolls off the tip of my tongue now when I give talks. I have no problem self-disclosing that I was diagnosed with depression over 10 years ago. It's actually freeing, again, to talk about that, because, again, there's no judgment. And if people judge me because I self-disclose, then that's on them. That has nothing to do with me. But I encourage you all to be your best self. I think oftentimes we want to wear a mask in society because we don't want people to see who we truly are. And I think we do ourselves a disservice when we do that. So be your best self. That's all we can be. If I had to leave you with some words of wisdom or words of hope, I would say be kind to yourself. I have to remember that each and every day. It is easy to be self-critical. We are our own worst critics, but I would say be kind to yourself. Have self-compassion. Remember that you are fearfully and wonderfully made by your creator, whoever you deem to be your creator. But have self-compassion, be kind to yourself. And I would also say, be willing to be vulnerable. Again, mental health, as one of our Surgeon Generals once said, Dr. David Saxer, he once said that mental health is fundamental to health. I'll repeat that. Mental health is fundamental to health. Without mental health, we don't have health. And so whether we're experiencing a pandemic at this time or other things in our life, I want to encourage us all to live our best lives. And the way we can live our best lives is being willing to be vulnerable, showing ourselves compassion, and remembering to ask for help. I thank you for your time and attention, and I'm happy to address any questions that anyone has.
I always forget to unmute myself. So thank you, Dr. Clark. So yeah, if anybody has any questions, please feel free to send them to me, and I will pass them along, and we can answer them. But yeah, thank you again for joining us today to share your story and your poetry with us. And yeah, I think this definitely captures what we were trying to accomplish with this series. So a question, that I had is, given like how would you say it's best to support people maybe around us that we can't see every day, that we normally used to when we are trying to like be distant in order to protect them? How do we help protect other people's mental health during this time?
That's a good question, Josh. So I would say, everybody, I should say everybody, but oftentimes we are hearing this term of social distancing. And I think we need to actually use a different term. I would use physical distancing, because I think when we say social distancing, that means, oh, I can't be around my loved ones. And that's not what we're saying. I don't quarantine myself from my wife or my daughter. I'm still I'm still there. I think we can still be present with people. We just have to do it, 6 feet apart or so. But I think during this time, I would use media outlets, the vehicles that we're doing this mental health series on, like Zoom. Call people, be creative. Check in with people. I think that it's important to call people, call them up, FaceTime, whether it be Zoom, if it's Skype, because again, you're right. We are used to being able to see people, and I think about my our daughter who is used to seeing her grandparents at least twice a month, and so she, and they miss her and she misses them, and so we have decided that we have to be creative. So we FaceTime. She is able to FaceTime with her grandparents at least twice a day, it sounds like, and on the weekends. And so I think we have to find new ways of connecting. We can still be in fellowship with one another, even though we are technically physically distancing ourselves from one another. But I'll tell you that some of my colleagues, we've gotten creative as well in our department. We do what we call a virtual happy hour. That doesn't necessarily mean it has to include libations, but just to see people's faces, that can be very rejuvenating, and the mind can be renewed and hearts renewed just by seeing people's faces. My wife and I told her for my 39th birthday, which was, again, just passed back in April, I said, I miss my friends, and I have friends Midwest, East Coast, West Coast, you name it. And so I said, you know what, let's just create a Zoom party. And it was wonderful to see my friends from Chicago. It was wonderful to see my friends from California or Texas. And I think we had about 20 or 30 people on at one time. And even though we weren't able to actually be physically there with them, it felt like that we were, because we were able to see their faces. And so I think that's important during this time, that we be creative. Just because we are doing the 6 feet apart physical distancing doesn't mean that we stop checking in on people. And for those people who feel like, okay, you know what, I can't turn to my family at this time, or I don't have friends, I'll put a plug in for Mental Health of America. We have hotlines that are geared to making sure that no one feels alone. Whether they are having thoughts of suicide, whether they just need someone to talk to. We are a very good organization, and there are obviously other organizations, but that advocate for individuals that are suffering and that do feel alone. So I guess I would say I want people to know that we are never alone. I think it's making sure that people have the resources at their fingertips, so to speak, so that they can reach out. But I also think we need to be creative in how we are, so that we can fellowship with people and still feel like we are connected.
Thank you. Appreciate that. Looks like. Yep. All right. So I think, thank you again, Dr. Clark. We are going to move on to the second portion of our session here, and briefly hear from our Director of Community Engagement, Susan Hare. She's going to just talk briefly about Mental Health America, what it is we do, and how you can get involved with us if you're interested in doing so. So Susan, if you could see if we can get this to work. All right.
All right, everyone. Thank you so much for joining us today. And just to echo Josh's gratitude to Dr. Clark. Dr. Clark, thank you so much for sharing your story, not only today, but through your professional work and your personal work, the way that you do. Your story is so incredibly inspiring, and it's something that so many of us and individuals in our community continue to benefit from. So thank you. I apologize for a bit of a delay in getting this up and running. So while I do that, I will just share with everyone that we are going to fly by these slides today. We are truly just going to run through them extremely quickly. At the end of today's presentation, if you would like to learn more about our programming and would like to go beyond what's on our social media channels and our website, please do not be afraid to reach out. We would love to have a conversation with you, tell you more about what we are doing as an organization, and then also how we need you. And that is a theme. Throughout Mental Health Awareness Month, we are repeating through a variety of different mediums and tools that we're all in this together, and that we truly need one another in order to increase access to care in our community, in order to positively impact mental health in our community, and to truly be the often life-saving difference that so many of us in our community need. So very quickly, as Dr. Clark stated in his presentation, mental illness affects all of us. So we know from national statistics that at least half of us will have a mental health diagnosable condition at some time in our life. And in fact, 1 out of 5 adults have a mental health condition at any given time. In fact, we know that 1 out of 4 14-year-olds have already developed the symptoms of a mental illness. And again, knowing that some of these stats are a little bit older, you can see that unfortunately with certain populations, including our seniors and members of the LGBTQ+ community, as well as youth, that these numbers are increasing. For example, rates of youth depression is increasing pretty quickly, not only in our country, but in our state as well. We know that overall in the US, the access to mental health services, there is some really great news. And in our community, there are some incredible partners, whether it's PRISMA Health Upstate, other providers of clinical services, providers of therapy, nonprofit organizations like Mental Health America of Greenville County, and other partners who are all working both independently and collaboratively to increase access to care. However, we also know that in South Carolina in 2019, South Carolina ranked 49th in regards to how successfully someone can access care when they need it. So there is a lot of work we all need to do. So in Greenville County, we know that the 2 major health systems, including PRISMA Health Upstate, conducts a community health needs assessment, and in the latest findings, we know that access to mental health care is the top priority item for Greenville County. You'll see number 4 is also access to health care in general, and that transportation, which certainly plays a huge part in access to mental health care, ranks number 5. So again, our mission as an organization is to positively impact mental health through advocacy, awareness, and service. And with those 3 different kinds of programming, I'm going to be talking a little bit more about what we do as an organization. We have been serving the Upstate for 65 years. Whenever we go out into the public or conduct a Zoom training and share this statistic, we always find that it surprises many people in the community, because so many of our community members may not know of Mental Health America of Greenville County, as we do truly believe that we have been working behind the scenes for so long, or people may be familiar with some of our programs. So starting off with that advocacy bucket, we provide services for individuals who have been diagnosed with a chronic mental illness, and we provide services that help ensure that these individuals are able to have the dignity and respect that every person in our community deserves. And we are able to provide these services through our Operation Santa Claus program, in which we collect new hygiene items for individuals who have been diagnosed with a chronic mental illness. With our housing services, we provide management services for 3 different housing units in Greenville County, and with our representative payee program, in which we help individuals who are disabled by their mental illness manage their finances. So again, they are able to live independently and to have enough money each month for medication. So our second bucket of services is our awareness and education programming. So I See Hope is our programs for individuals in our community who are in the youngest age bracket. This is an anti-stigma campaign. We start with children who are age 3 and go up to early elementary years. And the I See Hope, Don't Duck Mental Health program is book-led, in which a volunteer staff member reads a book about a particular mental health topic, to include things like bullying, grief and loss, anxiety, those kinds of mental health topics. And then it always includes discussion and an art activity. We also provide our QPR, Question, Persuade, and Refer presentations. We are currently doing them through Zoom as well as out in the public. And we provide these presentations to preteen, teen, and adult audiences. We have screening tools that are available 24/7. In fact, at the end of our time together today, I'm going to be challenging everyone to a couple areas. One particular challenge I have for all of you during Mental Health Month is to visit mhagc.org. Our very first banner on that page will take you to our mental health screenings. Please visit this page, whether you believe that at this point in time you are needing to complete one of these very quick screening tools or not, because you will absolutely come into contact with someone who could benefit from these particular screenings. And then we do have a speakers bureau on a variety of topics that include that QPR, but also include things like depression, bipolar disorder, and other mental health topics. We also have a Teens for Hope, Greenville County Behavioral Health Board. This is an opportunity for student leaders in their Greenville County high schools to come together once a month to learn about a behavioral health topic. It is teen-led, so the teens decide what topic they want to learn about and what topic they want to learn about, actionable steps that they can take in their school community to make a difference. Our biggest bucket, and the bucket of service that we are best known for, is our Crisis Intervention Services program. Our 24-hour crisis line, teen line, and National Suicide Prevention Lifeline are available for anyone at any time for any reason. We provide a non-judgmental sounding board, information on community resources, and crisis intervention. All of our volunteers, AmeriCorps members, and staff members complete over 65 hours of training before taking calls independently. Beginning in December 2019, we began serving the entire state with that National Suicide Prevention Lifeline. It is available at 1-800-273-TALK. And that teen line provides those same exact services, but when teen volunteers are available, teens handle those calls, chats, and texts. We do have a reassurance line, which is a warm line model in which individuals who have been diagnosed with a mental illness are hired and trained as employees in the program, and they call other individuals who are in Greenville County consumers of the Public Mental Health Center. And participants in the program receive calls based on their particular needs. So it can include things like wake-up calls, medication reminders, or conversation calls. We have two different AmeriCorps programs. One is the Greenville County Behavioral Health AmeriCorps Vista program, in which MHAGC serves as the sponsor. And beginning in July of 2020, we will be placing 26 vistas at 15 different nonprofit and government agencies for 1 year of service in order to increase access to behavioral health services in Greenville County. Our AmeriCorps State and National program has part-time and full-time opportunities. They focus on direct service and include things like serving on our 24-hour crisis line and National Suicide Prevention Lifeline, and provide that support and services for those who have mental health and substance use needs in South Carolina. We do have a survivors of suicide loss support group in which survivors who have lost a loved one to suicide are able to receive the support and are able to be surrounded by people who have really experienced that loss. SOS Loss is facilitated by survivors. We have an adult group, but we also have a youth group as well. We are continuing SOS Loss meetings remotely at the current time. And then MHAGC does serve as the telephonic provider through a contract with the South Carolina Department of Mental Health with the SCDMH's Community Crisis Response and Intervention. This is mobile crisis services. And here's just a really brief timeline. And then in terms of where we are, we need you. This is Mental Health Awareness Month, and it is the perfect time to consider a membership to MHAGC. South Carolina is one of the few states across the country in which National Suicide Prevention Lifelines do not receive any state or county government funding. And because of that, we rely very heavily on membership, fundraising dollars, and short-term grants in order to provide in the upstate the crisis line and teen line services. Secondly, we are going to be getting another online training class in June of 2020. It is important to note that all of our volunteers, after they are trained, do need to come to the confidential location of our phone room. And we do ask for a commitment of 3 to 4 hours per week for 1 year. However, we would love to tell you more about our volunteer opportunities, including serving on the hotline, and anyone interested can email us at volunteer@mhagc.org. We currently are looking for a location, a faith-based partner, another partner who may be able to provide some storage space and some packing location space for our Operation Santa program. And our incredible staff and volunteers are continuing to do an exceptional job of manning our our crisis line, our National Suicide Prevention Lifeline, and our other programs, this is a first responder role. And unfortunately, because of the anonymity that this role requires, we aren't able to give them the true admiration and the thanks that they deserve. If your organization or another partner may be interested in helping to provide some support and to provide a thank you to these volunteers and hardworking folks, would love to hear from you and figure out how we can brainstorm. Please contact us at MHAGC at mhagc.org if you'd like to arrange a time to have some additional conversations. Thank you all so much.
Okay, thank you, Susan. And yeah, that pretty much wraps up our day here. Thank you all so much for joining. I just wanted to share one more time how to get involved. So these are our social media accounts if you wanted to follow us there. That's where we post a lot of our information, articles, things that you can learn from, things that you can do, ways you can help, ways you can get involved, and make a donation to or become a member. Times are very trying right now, and we understand that. And so obviously only if you're able to, but if you're able to support us, your support is more important now than ever. So just something to keep in mind. But yeah, I want to thank you again for joining us. Thank you, Dr. Clark, for joining us. Keep an eye on our social media for we want to do one more next week, hopefully at the same time. We're still trying to secure our final guest, so our next guest. But yeah, Dr. Clark, if you wanted to send us off, how can people find you, reach out to you, follow you, support you, anything like that?
Sure. So you can follow me on Twitter. My Twitter handle is @tapkid. M as in Mary, D as in David. So I alluded to that I grew up dancing, so I used to tap dance. So I've kept that. It's actually my Gmail account too. But you can follow me at Twitter. I'm also on LinkedIn. So I usually post a lot of cool articles as it relates to mental health. So those are two ways to follow me, either at LinkedIn and on my LinkedIn account or on my Twitter handle again, which is @tapkid. M as in Mary, D as in David. So.
Okay. I know you mentioned your book. Is there a way that people can find that first book somewhere?
They can. So actually, if you go on Amazon and you type in The Other Side by Frank Alexander Clark, it should come up, and you can purchase it there. I think it's about $6. So.
All right. Well, very cool. Thank you. Thank you everybody for joining us. We will be we'll be putting this up on YouTube if you wanted to share it with people who maybe weren't able to join or you think would benefit from Dr. Clark's message today. And just again, it'll be on our social media once it's ready. So thank you all so much for joining us, and hope you all have a good week and a good month, and you hang in there, and you get involved with us any way you can if you're able to. So thank you.